Today we are going to discuss on the topic Bruxism. It's going to be a very short topic. The minute you see attrition, it is one of the signs of Bruxism. This is called an occlusal splint. When you have that clenching effect, like when you're getting angry and you're clenching your fist and your teeth together, the treatment part mainly involves occlusal splint.
Do you enjoy learning without distractions? Download our app now.
Very good evening to everyone over here. So today we are going to discuss on the topic Bruxism. It's going to be a very short topic. I'm not going to take at least half an hour or even more than that or something. I'm going to keep it very short, and so that we can just quickly revise whatever we know about Bruxism. Okay. So first of all, I would like to start with a clinical picture. So this is a clinical case. Probably I want to put this as an example because I want you guys to know how, when a patient comes, how do you diagnose Bruxism? What are the ways to understand that this patient is having Bruxism? Okay. So this patient, this was a lady, this was a case report taken. So if anybody wants a reference for it, please do get back in the group. So this was a 35-year-old patient who came to the clinic and told that she has severe jaw pain. In these 2 points, she had severe jaw pain and she wasn't able to sleep properly and she couldn't open her mouth fully. So this was her main complaints. So when she came, the dentist started examination. This was how the oral cavity examination was. So on oral examination, you can see the teeth over here are attrited. The minute you see attrition, it is one of the signs of Bruxism. But it is not slowly telling that like any kind of cases of attrition comes back to Bruxism. No. But this is one of the signs of Bruxism. So you can keep that in mind. So you go more of occlusal view of it, and you can see that there's so much of attrition happened to the teeth over there that the upper teeth is completely overlapping the lower teeth. The dentist went on to take a CBCT, and that's when he noticed. Can you see this is the right condyle and this is the left condyle. The right condyle has an osteophyte formation where the bone is almost closely touching to the condyle is touching to the TMJ, this joint. And so what happens is that there is no easy movement of the condyle over there. So because of the osteophyte formation, she's having severe pain over there. She's not able to open easily, or the mouth opening is restricted. So when that happens, along with that, you get all the muscles around this area becomes tender as well. So that becomes your TMJ pain as well. Okay. So can you see a clearer picture over here? Can you see the condyle osteophyte formation over here? So once that is there, what is the next step? So we understood the problem here is Bruxism. We diagnose it as Bruxism, and then we go ahead with further evaluation. Evaluation is done. Now we need to find the treatment. The safest treatment first is for occlusal splint. Now, occlusal splint, this is called an occlusal splint, but whenever you give this occlusal splint, it's not because you're giving it to completely treat Bruxism. Bruxism you cannot treat, but you can further prevent any periodontal reduction happening because of Bruxism. Okay, so we give this occlusal night guard so that in the night clenching or any other clenching processes happens, it can safeguard from the occlusal forces. Basically, this is given to distribute all the occlusal forces throughout. Otherwise, what is happening is when you're clenching, like when you bite like this, you're giving stress over here, and because the teeth is attrited in the anterior teeth, you're giving more occlusal forces is getting distributed over there. So when you get this, give this occlusal guard accordingly, the occlusal forces get redistributed throughout. So that way you're preventing further any harm to the periodontal system. Okay. So this is how an occlusal guard looks like. So this was given to the patient. And then there was a digital designing for the crown placement. And this is the digital design of the crowns which they have done. And Here they have placed the zirconia crowns, and this is how finally the patient was looking. There was reduction of the myofascial pain and the TMJ pain after this. Every 3-month periodic recall is required for this, because you need to see if it has worked or if it's still continuing, if the pain is still there or is it reduced more. So one of the major important part of this as well is the cause can be any stress related cause as well. Like any behavioral therapy can be done to understand the why this bruxism is happening, why there is a stress factor which is leading to this bruxism. So that can be treated alongside this as well. So this is the final picture of how the patient was. Okay. Now let's go back to our topic. Bruxism. First of all, what is the definition of bruxism? Okay. If we go to the definition of bruxism, involuntary, unconscious, and excessive grinding of the teeth. You're involuntary. You're not understanding. You're not doing it voluntarily. Like if I am doing this, that I'm doing it voluntarily because I know I'm doing it. But when you're doing it involuntarily, it is like even when you're doing something else, there is constant grinding of the teeth which is happening. That is called as involuntary. Unconscious. You're not aware that you're doing. This can also happen in sleep as well. That's why you would have heard the cases of sleep bruxism where when they wake up in the morning, they're having like severe pain and everything. So that's why it's called as unconscious. And excessive teeth grinding. It's a not normal teeth grinding which is happening. Okay. Another extension of the definition is forceful contact between the biting surfaces of the maxillary and mandibular teeth. So this much becomes your definition of the bruxism. Okay. Next, coming to occlusal parafunction, you have two things. First, let's figure out the distinction between bruxism and clenching. See, can you see, like if a patient comes with attrition and if you want to figure out like what is happening, is it bruxism or this thing? The main thing you have to figure it out is like is the patient through CBCT you can see the TMJ how it is. Is the patient having any other pain? Are there any other abrasion which has happened? Because if there is abfraction, abrasion along with the attrition, then it is, of course, geriatric patients do undergo all those. But again, to correlate, you need to see the TMJ, you need to see the muscles around that, you need to see if they have any pain over there. So all that, if it is there, then it comes under the bruxism category. Otherwise, also you can have only clenching, which is more often associated with the masticatory system disorders. The TMJ disorders, it's a whole another chapter itself. So when all the TMJ disorders there can be clenching disorders as well, where when you have that clenching effect, like when you're getting angry and you're clenching your fist and your teeth together, so you can have a slight pain. So it comes under that acute pain of clenching. So this is a clear distinction between the bruxism and clenching. Coming to sleep bruxism, what is sleep bruxism? Okay, first of all, it includes sleep bruxism happens when there is tooth grinding and clenching happening when you're sleeping. Okay, you don't realize it. But what happens is when there is constant clenching of this thing, like continuously, your sleep is disarmed. When you wake up in the morning, there is a severe pain over there, and like you don't get that peaceful sleep is not there. Okay. The next occurs primarily during the stage 1 and 2 non-REM sleep. Now let's go to what is non-REM sleep, so you'll understand it better. Okay. So the stage 1, it's a transition period between wakefulness and sleeps. That first few minutes is there, 5 to 10 minutes. That comes under stage 1. And stage 2, where the body temperature drops and heart rate begins to slow down, brain begins to produce sleep spindles, which last approximately about 20 minutes. So these two stages are the point where bruxism happens. And then you have stage 3, where you're completely relaxed, blood pressure, breathing, everything is like, drop. You're in deep sleep occurs. And REM sleep, brain becomes more active, body becomes more relaxed and immobilized, where you get dreams and eyes more move rapidly. So In the REM sleep and the NREM sleep of stage 3, you don't see usually bruxism. It's not like impossible, but usually you don't see these rhythmic activities happening in these two stages. Only in the first two stages you see these two bruxism happening. Then coming to, it is also associated with microarousal. So basically, sometimes there is brain activity which is happening. Like sometimes suddenly you wake up, right? Like sometimes they say you have sleep apnea. So when you have sleep apnea, you suddenly wake up and then you go back to your sleep. So those are these microarousals. So during those times as well, sleep bruxism can happen. Then rhythmic masticatory muscle activity, which is more intense. So when you see the rhythmic activity in these bruxism patients, you can see there is more intense than the normal patients. So these are the features of sleep bruxism. Coming to amplification of the damage. So excessive force. Why does this happen? Excessive occlusal force from bruxism. Because can you see the attrition happening over here? Why does it happen? Because you're giving constant occlusal forces, which is grinding the teeth. You're literally every day both the teeth are going like this, like this, like this. So you're grinding the teeth. Then increase the intensity frequency of the occlusal forces on the teeth, which is more susceptible to the periodontitis. So this is because, see, if occlusal forces on this happens like once a day, probably the severity is reduced. But the more the frequency of the grinding of the teeth is happening, the more the attrition happens and faster you see the attrition. Attrition of the teeth as you see over here in this picture, and myofascial pain. Now, what are the consequences of these? Increased frequency and persistence of the TMJ dysfunction. You have the orofacial pain. Entire region, this area will start paining for a long-term period. And you don't get direct periodontal disease because of this. What happens is because of the grinding, there is tooth mobility which is happening. Okay. So because of the tooth mobility over there, you get it leads to periodontal disease. See, excessive occlusal forces which leads to the tooth mobility. So can you see over here? This is another case where it happened because of bruxism. You can see that the incisors have migrated forward. There is attrition happening. And it's a clear case of periodontitis as well. You can see even gingival recession occurs because of bruxism. Attrition of the teeth can be very severe, as we saw the other case as well. And myofascial pain. So these are the 4 major signs and symptoms of bruxism. Tooth mobility can occur, periodontitis can occur due to depending on the intensity and frequency of the occlusal forces. Attrition of the teeth can happen, and myofascial pain. It happens more with daytime clenching. Next, coming to the treatment part. The treatment part mainly involves occlusal splint. So what is occlusal splint? It's a hard acrylic resin devices. Can you see over here? Hard acrylic resin devices in this picture. So this is placed in between the teeth. Okay. There is no actual cure for bruxism, but this occlusal splint, it acts as a protector of the teeth. As I told you, it doesn't directly stop bruxism overall, but what happens is the occlusal forces gets redistributed throughout, and that's where there's reduced attrition of the teeth, which is a more progression of the tooth mobility or periodontal disease. All that has been avoided because of this. Basically saying like preventing further damage. Then it's prescribed as a protective intervention to limit masticatory system disharmony. And it is mainly considered for patients with a habitual parafunction. So this is as a parafunctional habit breaker, sorry. Then, of course, we have the behavioral approach. We need to increase the patient awareness of the disorder. So patient might not even be aware that they have this kind of disease. So when they come, they might just come with a jaw pain, and they might not even be ready to accept the fact that they have bruxism. but you will have to sit and do the behavioral therapy to make the patient understand that what are the consequences if it has not been treated. What happens if you leave it at that stage? It can go further into tooth mobility, periodontal disease. Everything has to be explained to the patient in detail. Then you need to give them more, probably if there are stress relief factors can be helpful for them. You can advise them to go for therapy purposes. You can advise them for lifestyle changes. And of course, sleep hygiene instruction as well. So this much is about the treatment and management. So that's actually all about bruxism, which is there. It was a very short topic, which I wanted to put in over here. I can make a part 2 of it if anybody is interested, but we'll keep all these talks as short as possible so that we can interact more with the audience. But before finishing it, let me just ask the questions, because we have already put it in the group, like what are the questions for today. So bruxism, okay, here I would like everyone to mute out and tell me like what are the answers. Okay, bruxism is mainly due to psychological stress, diabetes, functional grinding of the teeth, or none of the above.
Psychological stress.
Yes, Dr. Anita, right?
Yes, ma'am.
Yes, you're correct. So this happens because of psychological stress. We ourselves, we know, right? Like when we are, tired or angry or some kind of stress, we try to hold our fist, or, we try to clench our teeth. So that happens a little more in psychological stress. So when a person is undergoing stress, there is more of involuntary clenching happening, which they are not aware of. So that is one of the factors. So diabetes is definitely not it's a cause for bruxism. Functional grinding of the teeth, this is called as non-functional grinding of the teeth, because functional grinding is the normal grinding which you do for the teeth. That will not cause bruxism. Okay, so I think this was pretty straightforward. Occlusal night guards are used to prevent bruxism, reduce pocket formation, redistribute forces on teeth, and permit eruption or elongation of the teeth.
Prevent bruxism.
Yeah. So this is a very tricky question, actually. So I told you, right? You cannot prevent bruxism directly. So you have to be very careful. I know bruxism, when you see, it's very nice to directly answer it. Occlusal night guards, yes, it's bruxism. But you need to see it more clearly. If there was no other answer for redistribute the forces on teeth, occlusal forces of teeth, probably I would tell yes, prevent bruxism. But here we have an option of redistributing occlusal teeth. So your answer comes to redistributing the occlusal forces of the teeth. Okay. Here it's not prevent bruxism. So next time you need to read out the answers properly to understand what the answer is. Bruxism causes the following except attrition of primary and permanent teeth, TMJ disorder, muscular tenderness, caries.
Ma'am, TMJ disorder.
Caries.
Oh, I didn't know bruxism causes caries as well. Can anybody explain how it causes caries?
Due to attrition and abrasion.
No, that's not caries. That's abrasion. That's abfraction. Caries is a different concept as well. Here, I told you, right? We spoke about the case report, right? So did you see that osteophyte formation, that condyle, that is a TMJ disorder. So definitely when you're having myofascial pain around the TMJ and there is muscle tenderness, it is all coming under TMJ disorders. There is muscular tenderness. Attrition of the primary and permanent teeth definitely is happening. But bruxism does not cause caries. It causes tooth mobility. It can cause periodontal disease indirectly, where it is again contributing to the tooth mobility. Okay. So here the answer comes to caries. Next, what is bruxism? A type of dental cavity, the grinding or clenching of teeth, a gum disease, or a type of oral infection?
The grinding or clenching of teeth.
Any other answer?
That was the easiest question.
Yes, correct. So I'm sure everybody know this. So bruxism is the grinding and clenching of teeth. Coming to what is a common non-dental treatment for bruxism: tooth whitening, behavioral therapy, root canal therapy, fluoride application.
Behavioral therapy.
Yes, behavioral therapy. I think that also was quite a direct question. So this was a short topic of bruxism. There's definitely, if I have to explain the entire concept and how bruxism, what is bruxism, causes of bruxism, everything, it's a long chapter. It will take us a lot of time, at least 1 hour, one and a half hours discussion it is. But we'll keep it short. All the topics like this short. We'll quickly finish and revise it so that it's easier for you as well. Anybody is having any questions here?
Yes, ma'am. Ma'am, I want to ask about the sleep hygiene instructions. What is that?
Sleep hygiene instructions. Sleep hygiene instructions, basically, you have to figure out why they are not able to sleep properly. Okay. So once that happens, you basically try to tell them like the stress reduction happens, right? So along with that, your psychological therapy has to be done first, because the stress has to be a reduced factor. So once there will be undergoing many medications as well, if there is a proper psychological factor to it. So then you can tell them like you need to go to bed early, wake up at the same time each day. Like, the sleep pattern has to be maintained. It can't be like one day I'm sleeping at 2 o'clock and the next day I'm sleeping at 8 o'clock early. So you need to maintain that cycle. So that is one of the basic sleep instructions which has to be given. And you need to create a relaxing bedtime routine. Like read a book or, hang out with your kids or something which relaxes you, that, or, probably keep an aroma and, relax your body. Some routine every day which relaxes your body just before, going to bed. Imagine you had a fight with somebody and then you're directly going to sleep. What happens? Again, that psychological stress increases. So if that patient is that sort, you can tell them, create a bedtime routine, relaxing routine. Then another thing you can say that make sure you're sleeping in a very quiet environment. You don't have too much noise around you. So all these are the, sleep hygiene instructions which you can try giving the patient. And especially phone. Please, you can tell them, like, we know as doctors, we also use phones. But before sleep, it's better to avoid the usage of phone and, keep it aside half an hour before at least, and then go to sleep early. All that. Even food, at least give some 3 to 4 hour gaps before sleeping. So all those becomes your sleep hygiene instructions.
Wait, there's more. But before we go further down the rabbit hole, subscribe to our channel.